Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Neuromuscular monitoring. For the neuromuscular monitoring, the ideal muscle used for neuromuscular monitoring is corrugator supercelli, which is on facial nerve. This corrugator supercelli is ideal muscle causing neuromuscular, which is ideal muscle for neuromuscular monitoring. This corrugator supercelli is more common than the orbicularis oculi. The most commonly used muscle for neuromuscular monitoring is adductor pollicis, that to the ulnar nerve. Modalities used for neuromuscular monitoring are train of 4 ratio is used, that is T4 by T1 equals to 1. Depolarizer can be used and a non-depolarizer can be used for the train of 4 response. The train of 4 response for depolarizers and non-depolarizers is different. So summary important thing is for neuromuscular monitoring, corrugator supercelli muscle is the ideal muscle followed by orbicularis oculi, and most commonly used for neuromuscular block monitoring is adductor pollicis, which is supplied by ulnar nerve.
thank you and thank you for watching.